Morning friends, I'm Dr. George Michael. Today my subject is hemorrhoids, piles. Hemorrhoids usually the swelling of the perianal region because of the veins. What you have the veins that causes the engorgement or enlargement in the anal region or rectal regions. So basic common causes, it's especially very common seen in the pregnancy time. That's mainly because the pressure on the uterus, which causes again the pressure on the colon, so that causes the bulging of the veins in the rectal area, otherwise the anal region. Second thing is habit forming of the delayed defecation reflexes. People tend to neglect when they have the feeling of the going for the maybe the stool, they neglect. That causes a lot of pressure on the veins, so that may cause the irritation or engorgement of the vein. Third thing, chronic constipation, diarrhea. Okay, that also very common. Most of the scene we have seen it. So usually few symptoms are like painless bleeding, any discharge, anal discharge, and itching, and sensational lump, other irritations. Okay, so you're not very comfortable while sitting position. That causes little irritation. Usually seen. And in the hemorrhoids you find two things. One thing is internal hemorrhoids and external hemorrhoids. Usually internal hemorrhoids, it's invisible. Only few symptoms are like painless bleeding, usually on the straining. When you strain for that, you start getting bleeding. And the external hemorrhoids, it's usually the bleeding on straining, but only when it's more of painful because a lot of the external like area, it can lot of the sensitive node that causes the paining. So now, how do you prevent this? One thing is taking a lot of fibers, okay, taking a lot of fruits and vegetables, and very important, when you get the defecation reflex, we call it like when you feel for going for the stool, go immediately and empty the bowels, don't delay it. Okay, and usually the treatment part comes this way: surgical, non-surgical people, like there is one method called sclerotherapy. They inject the solution in the end part of the hemorrhoid, so either it shrinks off or falls off. Second thing, ligation, rubber ligation method. The process is same thing. They ligate the part, base of the hemorrhoid, they ligate. After some time it may fall off, or because the cut off of the blood supply, it may shrink. And second things, very important, we wait for the things to get complicated. We call hemorrhoidectomy. That's usually by stapling. This is performed under general anesthesia. So usually they remove the prolapse part, external part, they prolapse it, they go for the incision, surgical incision, they remove the part. And the very important thing is what happens when you neglect it. One thing is called strangulated piles, the hemorrhoids. Second thing is clot formation in the anal region, maybe the veins. Okay, third thing is anemia, because you lose a lot of blood, we call occult blood storm. So iron supplement get depleted in the blood, so a lot of RBCs are wasted in the blood. So that we usually call the anemia. The patient become very weak, the anemic, suffocation comes, and those symptoms start coming there. And clinical complications are very two things. One thing is like perianal abscesses. Second thing, other perianal thrombosis. Third thing, incarcerated internal hemorrhoids. So that required immediately surgical intervention to relieve the pain, because it will be more painful to relieve the blood clot in the veins. So don't wait these things to happen. Now my subject is the best of nature and best of science, the homeopathy medicines. So when you get the symptoms of, like usually get the symptoms of constipation, chronic diarrhea, and especially in the pregnancies, start taking few medicines like ruta, hemamelis, calcareflo, thuja, pulsatilla. Don't take my advice from other online, because he required this medication based on your onset of the symptoms, based on the time of symptoms, based on the stages. Okay, you consult a proper homeopathy doctor. So what you get the result, basically main motive of the treatment is not to enlarge the veins in the rectal or anal regions. Okay, not to engorge the vein, not to irritate veins. That when you take the homeopathy medication, that makes the internal venous correction, so that the symptoms will not be repeated very often. So almost when you take the homeopathy medicines, your symptoms are normally irreversible. Those symptoms will not reverse back. That is what the most of the experience we have seen it. So that's all for right now. So I'll be back with one more signal surgery very shortly. Thanks for watching. Have a good day.